Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday, the 15th of September 2021. In terms of COVID positive numbers, the number in the trust today is 54 positive patients. That's those within 14 days of their first positive diagnosis. We've got 50 patients on our general wards, 3 in critical care and 1 at Clifton. And there's also, I think, 13 patients in addition who are in hospital because of COVID, but are more than 14 days from their first diagnosis. So not thought to be infectious with COVID, but in hospital because of COVID. I'm sorry to say we've had 3 deaths linked to COVID this last week, so condolences to the families and loved ones of those individuals involved. That takes our total since the pandemic began to 800. In terms of community numbers, well, I'm sorry to say we've seen a continued increase in the numbers across the Fylde coast. So for Blackpool, the community prevalence is now up to 592 per 100,000, and for Fylde it's 456, and for Wyre it's 433. What worries me particularly in that information is that the prevalence in the over 60s has shown a rise in these last couple of weeks, and if we just think about age as a risk factor for getting poorly with COVID, obviously that's not great to see. So it means we must remind ourselves to be extraordinarily vigilant about the possibilities of acquiring or transmitting COVID. And it's worth saying that if you think you are symptomatic with COVID, and I've said this I guess many times before, please arrange to have a PCR test. It's a PCR test that gives the definitive answer, and to self-isolate until the result is known, and if of course the result is positive, to continue to self-isolate for a period of 14 days. All the details about how to get a PCR test are most easily acquired on the nhs.uk website. Other things to say about vaccination. So any adult over the age of 18, or indeed within 3 months of their 18th birthday, is immediately eligible for a COVID vaccination. And with rates of just 72% for Blackpool adults having had both doses, I think there's still a lot of work to do in that space. The figures for Wyre and Fylde are 82%. So if anybody is still wondering about having a COVID vaccination and is in that group, please go forward and have one, because still the higher we can get that rate, the better. In terms of boosters, we know there is going to be a booster programme, but we still haven't got the final details, so I will update as soon as possible. But I still recommend anybody who's eligible for a flu jab to go ahead and get that as soon as possible, and that is any adult over the age of 50, all ladies who are pregnant, so that would include a flu jab and a COVID jab, and then essentially a list of people who've got chronic conditions. You probably already know who you are, but the list of conditions such as diabetes, heart disease, respiratory disease, liver disease, they're all on the nhs.uk website if you want to check. Probably the last thing to say is that our accident and emergency department, both here and in fact really everywhere, incredibly busy still, extraordinary, unprecedented demand. So I apologise to everybody who's had a long wait in our accident and emergency department, either to be seen or to be treated or waiting for a bed. I'm sorry it's happening. We know everywhere's extraordinarily busy. What it does mean is if you've got a problem which is urgent but not an emergency, please will you be thoughtful about trying to manage that in other ways. So advice on the NHS 11 website or on the phone number 1119, seeking advice from pharmacies, general practice, walk-in centres. But of course, if it's an emergency, that's what the hospital's here for. We will of course do our very best to see you and look after you. So COVID's still an issue. We anticipate those numbers are going to keep rising, so please be thoughtful about that. The old issues about space, safe space, good airflow if you're inside in groups and so on. Try and make sure there's good airflow. Hand washing still so important, and maybe wearing masks if you are in close company. And if you're coming to the hospital, of course, we will ask you to put a mask on the moment you arrive, and we're maintaining our infection prevention and control procedures as you'd expect. So thank you so much. Stay safe, and I'll update you next week.